session. And if you are muted, if you have a question for the panelists, please use the Q&A and or the chat box. We prefer the Q&A box, preferably. Drew, thanks for being with us, and I'll turn it over to you.
Okay, well, thank you so much, Arnold. I'm Drew Montroy. I work as the Director of Government and Stakeholder Relations for our College of Agriculture and Natural Resources, which includes MSU Extension and our College of Veterinary Medicine. And I'm really happy to be here today with our panelists to give some updates on the supply chain. I know this is a topic that all of us have been hearing a lot about. So please feel free to ask any questions that you have, and we'll be happy to talk through those. Let me introduce our panelists. We have Dr. Vidit Verder, who, let me advance the slide here, you can see, joined our MSU Broad College of Business just last year. He's the John McConnell Endowed Chair of Business Administration and also serves as the chairperson of the Supply Chain Management Department. His areas of research are service chain design, hazardous materials logistics, sustainable operations, and healthcare operations management. We also have Dr. Brent Ross, who is an associate professor and associate chairperson in the Department of Agricultural, Food, and Resource Economics in our MSU College of Agriculture and Natural Resources. His primary research interests include the dynamics of entrepreneurship and the use of simulation methods to explore organizational phenomena in the agri-food system. And so we'll be able to hear a little bit about how the supply chain has impacted the food that we see in grocery stores. I know many of you have experienced that and also have received questions about that. And we also have Dr. Judy Whipple, who is the Bowersox Thull Endowed Professor of Logistics and Supply Chain Management. She's also the faculty director of the Master of Science in Supply Chain Management program in the Broad College of Business. Her research interests include supply chain integration and collaboration, supply chain security and risk management, and strategic supply chain management and organizational design. So you can see that we've pulled together some incredible experts on this topic to give you some information and also to share their expertise, but to answer your questions. We're going to have each panelist present for about 10 minutes or so. If you have any questions during any of that time, as Arnold mentioned, please feel free to use the Q&A. And if we don't answer them immediately during the presentation, know that we'll keep an eye on them and we will come back to them. And then we'll have some time at the end for discussion. So I will now turn it over to Dr. Verder.
Thank you, Drew. Much appreciated. And thanks to the Institute for the invitation to be part of this opportunity. I wanted to first start with what we intend to do in the next 25 minutes or so. I will talk about the basics of supply chain so that we bring everyone to the same page in terms of what we are discussing and the impact of the pandemic in general terms. Then Brent and Judy will focus respectively on the agri-food and pharma sectors for bringing the discussion from the more general level to the more specific industry sector level of where we're going from here. Next slide, please. So I wanted to start with a real-life example of how a supply chain looks geographically. This is Dell's global supply chain, and you would see here is that most of the parts and sub-assemblies of a desktop or laptop computer are manufactured in the Far East. The power supplies are done in China, and they also have sound cards coming from France. And after this production of parts and sub-assemblies, they're all shipped to North America, and the production is completed in their Texas facility. This is a significantly complex supply chain to manage. I would say that it's actually a very helpful picture to understand how geographical distribution of the supply chains work across the globe. The only other comment that I would make on this particular slide is that I am not impressed with the geographical knowledge of the people who prepared the slide, because some of the countries are not where they show them to be. China is not definitely on top of India. So next slide, please. So in that context, meaning that if buying a desktop computer involves so much activity in the background, what does supply chain management mean? Supply chain management involves matching the supply side and the demand side to make sure that the products are available to the clients when and where they're demanded. And we would see in terms of the impact of COVID that this flow, the synchronized flows through supply chain are broken, and therefore what you need is become unavailable at the time you need it, or it has become unavailable in terms of the particular product that you need. And that all relates to the fact that all relates to the impact of the pandemic on breaking the synchronization of the flows in the types of supply chains that I shown you in the previous slide. Next slide, please. So what we do is that we generalize from that particular supply chain to a structure like this. When we say a supply chain, just in case you're curious, this is the type of visualization we have in our minds as scholars who work in this area. And what we're interested in is to basically arrange the nodes of that network, such as the factories and distribution centers, as well as the flows on that network, so that at the end of the day, the customer's on correct time at the downstream levels of the supply chain. Next slide, please. So to be more specific, there in a general supply chain, there are a whole bunch of stakeholders, from the people who supply the raw materials, to the processors, to the people who, the companies who produce transportation or warehousing services, to the manufacturers, wholesalers, and retailers. So, so synchronization of a supply chain is easier said than done, because that involves making sure all these participants work hand in hand to provide the product or the service at the end. Next slide, please. So in general, the impact of a pandemic like COVID is that the supply chain relationships are broken, and there may be many reasons for that. But one of the more distinguishing characteristics of this particular pandemic that we have been going through is that it had effect because the pandemic has been experienced both, let's say, in China and in the United States together. So although in sort of the more common and less disastrous situations, we would have one layer of the supply chain affected at a time, such as in the case of a hurricane, a facility may go down in the Louisiana area. This is a case where multiple layers and multiple participants in that supply chain that I mentioned you have been disrupted. So when there is a sudden demand for certain essential products, such as PPEs like masks or ventilators, or even toilet paper, we experienced inventory shortages, and we couldn't react to those inventory shortages because our capacities have not been built for dealing with that unprecedented hikes in the demand. In addition to that, since this is primarily a particular sector that has been influenced is the health sector, And the peak in demand in the health sector is particularly noteworthy, which causes, of course, the congestion in the health systems, and that resulted in the pop-up of the Sahara hospitals and et cetera, where we try to generate extra capacity. Next slide, please. So in terms of pinpointing a few of the primary reasons for these challenges, I would say that the tendency for globalization, meaning offshoring many of the parts and sub-assemblies we use in our supply chain, such as the Dell example that I showed you, basically brought significant distances among the facilities in a supply chain. And that, of course, became a problem when there was disruptions. And that also lead to, of course, the global supply chains are inherently more complex to manage, and particularly, visibility across the supply chain becomes an issue, together with the lead times and the different parts of the supply chain becoming dependent on each other. So basically, because most supply chains in the past couple decades or so have been designed for having cost in mind, and I would point out that many of the supply chain vice presidents I have talked to in the Michigan area have mentioned me, taking cost out of their supply chain as their primary mandate. And when you do have a single objective, narrowly focused objective goal, then what ends up happening is that you are driven towards the lower cost suppliers of personal protective equipment or ventilators or other equipment. And that makes, of course, your supply chain vulnerable to disruptions like the ones that we talk in the context of COVID. I believe this is where, can I see the next slide? So this is where I pass the torch to Brent. Based on this sort of general introduction, Brent will start talking about agri-food supply chains in more detail. Brent?
I guess it helps if I unmute myself. Hi, everybody. So I'm going to dive in a little bit more detail on just the effects of COVID-19 in the agri-food sector. And so taking what Dr. Verder's already mentioned in terms of thinking about kind of a base model supply chain, a base model for agri-food supply chains would look something like this, where we have, suppliers, farmers, growers, and processors working to produce a product that you would ultimately get in a grocery store or in food service, and wholesalers, retailers, doing a lot of the marketing processes that would be involved in getting those products onto the shelves and into the restaurants. And so one of the, I think, features of agri-food chains is that given many different attributes of food, and we'll talk about what some of those are in a minute, we don't have kind of a one-size-fits-all type of supply chain. And so supply chains really vary a lot between commodity to commodity, whether we're talking about apples versus meat, or blueberries versus seafood. And they also vary from business model to business model. And so a lot of you are probably familiar with getting food at a farmer's market. And so the supply chain that is designed to get blueberries to a farmer's market where you could buy them is quite a bit different than when you buy blueberries at a grocery store. And so we'll talk about some of those various different attributes that are important to think about in terms of how supply chains are designed for food products. And so next slide. And so one of the really important things to understand about food and how it ultimately arrives at your table is that food is derived from a biological process. And so there are often very long lags or delays between when a producer might make a decision on whether to grow a product and when a consumer might actually consume it. And so, if we're talking about apples, a farmer, a grower would make a decision in year one about whether to plant a tree, and they wouldn't really get apples from that tree until 6 years after that. And so, there's an example where we have some very extreme lags. If we're talking about things like poultry, that lag might be closer to 7 weeks between when a chick is born to when it would be slaughtered in a processing facility. So there's quite a bit of variation in terms of just the production lags in different types of food products. The other unique feature I think about food in agriculture is that these products are grown primarily outside, although there are certainly technologies that are coming into place that are changing that. But when food is grown outside, it then has to, or is then affected by all of those other things related to weather, soil conditions, that can certainly affect both the quantity and quality of products that are ultimately grown and produced. At the same time, we have a lot of products that you would consume in a grocery store that would not be grown here in Michigan, or in some cases in the US. And so if we think of a product like bananas, the supply chain from getting a product from Central or South America to your dinner table is quite a bit different than what we might expect for something like blueberries that is grown on the west side of the state. Another factor that is really important in terms of thinking about agri-food supply chains is labor. And in particular, this trade-off between using labor to grow or process a product, or using technology and machines. And so we have some food products that are very labor intensive. So you can think of a lot of fruits and vegetables that really rely on hand picking, hand harvesting of those products versus other products that might be more mechanized, so such as some of our row crops like corn and soybean and wheat. Another feature to think about in terms of food is product perishability and storability. Some of the products that we eat, they require us to process them, and they require us to refrigerate them, or they will go bad in a matter of hours or a day. And so think of products like meat that are very highly perishable. And if we eat meat products in particular, past their best before date or after their best before dates, we start to run the risk of various health issues and really getting very sick. Whereas other products are much more storable. Blueberries might last up to 2 weeks. Apples would last even longer. And so there are some technologies also that we can use to store those products as well. And some products we just don't consume fresh at all. And so that's kind of also related to a set of standards and regulations that we have around food safety. And the one thing that I want to kind of stress here is that often it's the case that the food safety standards that we have for one supply chain are quite a bit different than the set of standards and regulations that we might have for another. So for example, one thing that we do find is that the food safety requirements to sell a food product in retail, okay, is quite a bit different than the standards and regulations that are needed to put a food product through a food service channel that is, requiring products in much larger lot sizes, and having various different processes that are going to be handling the product as well. And then the last one is consumer demand. And so, we are all consumers. Many of us are very particular and have very stringent specifications for what we want our products to look like. Specifications on how we expect our products to be grown, whether that be organic or using conventional means. And then that also affects a consumer's willingness to pay for food and those different types of attributes. And so next slide. And so to look at two particular industries in the US and the effect or the implications that COVID-19 has had on those, I'm going to give you kind of two very different kind of case studies here. And so if we look at the US meat industry, the US meat industry is quite concentrated, and there's been a lot of consolidation that has taken place, really over about the last 20 or 30 years to specialize our processing facilities in order to capture some of those cost savings and efficiencies that Dr. Verder talked about earlier. And if we look at where processing capacity is located, the vast majority of it, and upwards of 80% of it, are really located kind of in the upper Midwest states, and even more so in the plains, the North and South Dakota, Iowa, Illinois, Minnesota. In terms of labor intensity, so most farm animals, they could be grown indoor or outdoor, depending on kind of on the business model. But in terms of growing animals, it's a relatively low intensity labor force that we use there. However, that changes dramatically when we start to process that product. And so I didn't touch on this earlier, but the one thing that is true about livestock is that we don't consume fresh livestock, right? We have to process that cow or that pig into other products, meats, our steaks, our hamburger that we then consume. And so processing is a necessary part of the game here. And processing takes place inside a processing facility. And often it's the case that those facilities require a lot of labor. And the way that those processing systems have been set up, it often requires that labor are placed closely together within those facilities in order to maximize processing capacity. And so one of the things that I think we found in the meat sector is that with respect to COVID-19 is that the problems didn't happen post or should say pre-processing facility. COVID-19 didn't have a large effect on on-farm production of livestock. Where we have seen issues is when we get into the processing plant. And as we saw in April and May especially, we had a large percentage of our labor force get very sick from COVID-19, which required plants to certainly scale down production and in a lot of times to actually shut down processing capacity. At the same time, thinking about where that product goes from that processing facility, oftentimes it's either going to go into food service or retail markets. When COVID-19 hit, as many of you know, our restaurant and our food service industries essentially closed their doors and shut down as well. And so for many of our products, they really had no place to go at that point. Because as I talked about earlier, one of the things that is true as we have specialized and consolidated our processing capacity is we have created a lot of rigidities and inflexibilities within the different channels that we can sell product to. So the product that we are selling to food service looks very different than the product that you end up seeing in your grocery stores. And so there's a lot of this inflexibility. And so in terms of the meat sector, we kind of really had two shocks. One is this demand shock, where essentially the food service market shut down, and consumers essentially ran to grocery stores and started panic buying and stocking up on food products, and in particular meat in this case. And so we had a dramatic shift in terms of the demand through various different channels in the food system. The other shock occurred on the supply side, where what happened is that we saw a significant downward shift in the amount of meat that we could produce, such as your steaks, your ribs, your hamburger, not because of changes that affected the on-farm production of livestock, but because of the effects of COVID-19, especially on the labor supply within the processing sector of the supply chain. And so that's why you saw media reports where you would see that milk was being dumped on farm, or also media reports talking about livestock being slaughtered or killed before it got to a processing plant, just because there was no capacity at that plant anymore. Now we can compare that to the blueberry industry, which is very different from the meat sector in that upwards about 70 to 80% of that product is fresh product that we consume. There's very little of it ends up being processed. And so if we can kind of think about the ramifications that might have in terms of the effects of COVID-19, in terms especially of labor intensity, where harvest, essentially takes place outside, okay, where we do know that there are certainly benefits to that related to COVID-19, although certainly there would be relatively high labor intensity of the number of pickers that might be used to pick blueberries, however they are outdoors. But on the processing end, when they're indoors, right, there is very low, compared to meat anyways, low labor intensity. A lot of that would be mechanized. And so two things there. One, there's very low level of processing of blueberries to begin with compared to meat. Most of the product is fresh. And when it is processed, it is much more mechanized than the meat sector. In addition to that, when we talk about the outlets, the marketing outlets for blueberries, they really did not see a significant change in demand for blueberries. And so they were able to shift blueberries that were destined to the food service channel. They were more readily able to move that to retail, the retail sector. And one thing about the blueberry industry right now is, for quite a long period of time, they have been going through a real uptick in demand for blueberries. And so in terms of the differences between the meat sector and the blueberry sector, the blueberry sector has not been as affected as the meat sector in this case.
I think if you want to go to the next slide. Thank you. So this slide also shows some of the complexity that we've been discussing already. This is kind of the pharmaceutical supply chain ecosystem. And this is really just showing at that first level of suppliers. There would be additional suppliers upstream if we trace that back to raw materials. But in the pharmaceutical supply chain, we really divide the first tier suppliers by active pharmaceutical ingredient, or what we call API suppliers, and other suppliers. So APIs are, oops, if you can go back one slide, thank you. APIs are the ingredients that create the intended effect in a pharmaceutical product. There are roughly over 1,500 API suppliers around the globe. Due to cost pressures in the pharmaceutical supply chain, there's been a trend in the last decade for APIs to be produced offshore, especially in China and India. In fact, only about 30% of API facilities are located in the US. The other suppliers include suppliers of excipients. These are additional ingredients such as binding agents like gelatin that would go into that pharmaceutical product, as well as other suppliers of materials such as packaging. The next stage in that pharmaceutical supply chain is the pharmaceutical manufacturers. And these can be categorized by the type of product that they produce. So we have, for example, branded products, which generally have a patent associated with them. There's also generics as well as biologics. There are thousands of pharmaceutical manufacturers. It's actually difficult to know exactly how many, because any pharmaceutical manufacturer may sell in all three or some subset of those categories. But it's probably fair to assume that there's at least 3,500 or more pharmaceutical manufacturers. Most pharmaceutical manufacturers sell their product through a distributor. We have kind of two types of distributors. There's this sort of traditional distributor that we also call a full line distributor. And these distributors not only carry pharmaceutical products, but they carry additional medical products. It could be masks, it could be gowns, it could be medical equipment. And so really they offer the retail, which we'll talk about in a second, kind of one-stop shopping for all those medical supply needs. We also have, well, let me mention first that there are really three main national traditional distributors, and they represent about 90% of market share in this category. In addition to those three national, there are numerous regional and smaller distributors in that category as well. Then we also have specialty distributors. They carry products predominantly for chronic disease. And these products are typically something that might be injected into the patient in a hospital or clinical setting. So as I mentioned, most product will go through a traditional distributor to the retail stage. And so that is roughly about 92% of product will go through a distributor. Only about 8% will go direct from the manufacturer to the retailer. In terms of pharmaceutical, we talk about retailers as really being dispensaries. So dispensaries could be those retail pharmacies, as well as non-retail outlets like hospitals and clinics. And there are over 180,000 different dispensary locations in the US. So you can definitely see the complexity associated with moving that product from supplier through to dispensary, but also trying to understand not just the product, but the financial flows, as well as the information flows that need to occur. So if you could advance the slide, please. So when we think about the pharmaceutical industry and we kind of think about what were some challenges pre-COVID, because there were various challenges to this industry, one of the main being a tremendous pressure on cost as healthcare costs are rising, as we are dealing with an aging population that's more expensive to serve. There's been a lot of pressure on cost reduction And that's driven, as I mentioned, some of that offshoring. There's also been some regulatory considerations. One of the probably prime examples of that is the Drug Supply Chain Security Act, which is going to require some traceability from manufacturer through to, dispensary. And, and that was really put in place to try to reduce some of the counterfeit products and improve safety in the industry. We have in the past, there have been other examples of drug shortages, not quite to the level that we've seen in COVID, but drug shortages. And this relates a little bit to agri-food. Again, there's often a lag between when a product is produced and when it's consumed. And so if you take something like the flu vaccine, they're developing that vaccine, they're forecasting, what types of flu strains might be coming that next year, as well as the demand for those vaccines. And so there can be challenges with making sure that forecast is as accurate as possible. And then I mentioned that financial and information flow can be a challenge. And so certainly visibility is often a challenge. If you take, for example, in that drug shortage, just in a case of a drug shortage, just like we saw with consumers running to the grocery store to, buy meat, there can be some similar hoarding behaviors in those supply chains as well, where inventory may be higher in a particular dispensary or in a particular region, and the demand is not needed there, and there's challenges with circumventing that product to where it's truly needed at the moment. And so I think in addition to those challenges, post-COVID, we'll see some additional impacts to the pharmaceutical supply chain. Certainly, it's going to be important for us to think about how to develop more responsive and adaptive supply chains that are more resilient to risks like disruptions. This might mean firms carrying greater safety stock or building duplicate manufacturing facilities, diversifying sourcing, diversifying manufacturing location. And it's also important to stress that when we're dealing in pharmaceutical supply chains, again, there is significant regulation. Obviously, we want to stress safety, but that means that you can't just create an additional manufacturing facility or bring on additional suppliers overnight. That really requires some long-term planning and approval processes. I also think it'll be important in the wake of the pandemic to assess allocation and coordination efforts. And to look at what went well and what could be improved in terms of government response to COVID. And this assessment really needs to be done in a fact-based, nonpartisan manner so that we can understand what are the best allocation options. Is it a centralized federal government level, maybe utilizing agencies like FEMA? Or are there decentralized efforts at the state, county, or city level? Or is there going to be some hybrid option mixing of those two? And this will also mean looking at greater efficiency. Should we be consolidating purchases of pharmaceutical and medical supplies? Should we be revisiting stockpile decisions? An understanding that that adds its own challenge because we need to think about the perishability of that stockpile. And as products are getting close to the end of use date, how do we get that into the regular system and replace the stockpile so that we're utilizing that inventory efficiently? And finally, I think there will be looking at structural and regulatory changes, whether that is long-term purchasing agreements with manufacturers, for example, for guaranteed volume, or whether that's economic incentives to build slack resources in the industry. And also, it's likely we'll see greater calls for country of origin information, not just for the finished product, but also potentially for the supplies going into that finished product. Next slide, please. And so kind of, we've touched on some of these. I'll kind of give these again as sort of high level, thoughts in terms of where we might go from here. Certainly, developing cross-industry collaboration. We saw automotive jumping in to make ventilators, consumer products companies shifting from, apparel to making masks. And so we definitely saw a lot of innovation in various industries to help respond to COVID issues. Brent talked about some of the trade-offs between, labor and technology. And, sometimes we can't move away from labor because of the specific requirements, for example, of harvesting a product. But also, how do we think about protecting that labor? Where can we put technology, and then what's the implications there? Thinking about, again, that innovation, new products, whether it's vaccines or new pharmaceuticals that can help, respond to, reduce the symptoms of COVID or protect from COVID. Thinking about substitute products and substitute supply chains. So as Brent was talking about, how quickly can we shift from a food service supply chain to a food retail supply chain, and what are some different things that we might be able to do there? And this really gets us back to thinking about balancing costs and risks. When we want to, consider protecting against risks like stockpiling, we have to recognize that there can be a significant cost associated with that. And how do we try to determine and trade off between that cost and risk piece? And then finally, I think as we move forward, there will be continued opportunities to establish public-private partnerships where, we can be learning from a public standpoint what private industry is doing in various industries that we can apply to help in the face of any future disruptions. So I think that's our formal talking points, and we're certainly happy to take questions that individuals might have.
Great. Well, thank you so much to all of you for those presentations. I have to tell you, I always appreciate those recent and real life examples that we've all experienced in the explanation to help us understand the why. So thank you all for including those. I'll remind our attendees that if you have any questions, you can use the Q&A and just type your question right in there, and that we'll read it off and make sure that it gets answered. I do have a couple questions just to get us started. I'm wondering, Vidant, maybe this question is for you, but please, as panelists, just pitch it to whoever you think's the most appropriate person to answer it. We've heard over the course of the last 6 months or so that because of some of the efficiencies that we've created in the supply chain, and I've heard the term used, this just-in-time supply chain, that it actually created some challenges for us. And so I'm curious if you can give us any examples of how that, or reasons for how that played out at the start of the pandemic or during the pandemic, and if all of you, I know, speak with industry partners, if there's any changes being made to prevent that in the future.
Thanks, Drew. The just-in-time is slightly different concept than sort of the cost efficiency concerns. And I would think that it is the cost efficiency concerns and sort of reducing the cost mindset without particularly paying attention to the resilience of the supply chain that got us here. And the particular example of that, Judy mentioned that if you were going to purchase ingredients, APIs for your active process ingredients for your pharma products, then the most likely place for you to go is China or India, which means that a very small proportion of your ingredients are actually produced onshore, meaning in a reasonable distance from your company. So when there are disruptions in transportation, for example, I mean, something we haven't talked about is in addition to everything that was mentioned, there was also disruptions in the transport sector where things couldn't leave China, for example, or wouldn't leave China. So when that happens, your ability to supply them just in time in your facilities is quite under stress. So the idea is that, and that's where the cost-risk trade-off again. Both I will call him Dr. Ross because he keeps referring me as Dr. Werther. So Dr. Ross and Judy has mentioned are important because as you build more resiliency into the supply chain, which means in this case that you will increase the amount of APIs, ingredients that you produce onshore in the United States, or at least in North America. As you increase that, obviously you're going to incur additional cost, but that will decrease the risk of disruption to your supply chain. It is that balancing act for which the top management of companies are, paid the big bucks, and you have to make those, trade-offs. And of course, that's where the, legislator also comes into place. Where do you actually, discuss or require a minimum level of resiliency in some of the, for some of the more essential products, so that, when you need ventilators, you don't scramble, on how to produce them. I want to remind people that it wasn't a smooth process where, it was great that the automotive manufacturers stepped in and started, making ventilators, but I want to remind everybody that they didn't even have the designs. Thankfully, the ventilator producers actually made available their simpler designs so that the automotive producers can shift into doing that. And I would suggest, for example, in terms of resiliency, and going along with some of the examples that Judy gave, if we had preparations for those kind of emergencies beforehand, rather than people figuring out intuitively what they should be doing after a disaster strikes, that would be a much better sort of exercise.
Thank you. While we're on this topic of concepts, another one that I hear interchanged occasionally is people use the terms value chain and supply chain interchangeably. And I understand that they're different. And so I'm wondering, all of you, teach some form of supply chain. Can you give us an explanation of why they're different, and if there's any easy way you help your students remember the difference?
So I think Judy is the, best.
I was going to throw that to you, but I think, sometimes for me, I have a hard time distinguishing, quite frankly, because I think in supply chain, that's what we are doing, is we are helping to bring that value. Now, we're not the only functional area within a firm that contributes to that value chain. But certainly, we might have the strategy of the firm, which could be about the products they're going to produce, the business model, et cetera. That would, really be driving that complete, sort of value chain philosophy. But in the end, we in supply chain execute that plan, and our ability to do that really is about how well aligned our supply chain structures are with the strategy, with that value added strategy that the company is focused on providing. So I'll start with that and let others jump in.
Yeah, I would want to add, the following, which I see often among my students, that there's a bit of a hang up on the term supply, in the term supply chain. I think the more operative term there is chain, and so, for example, students have a tendency to think about manufacturing contexts when they think about supply chain. So it's a lot easier for them to understand when we talk about, for example, pharma. This is why we wanted to intentionally give an example of, with a service component such as the agri-food, So this is why I actually showed the sort of the process flow model of a supply chain at the very beginning. You know, whether that's a manufacturing context or a service context, you could still view that, you know, as a chain and how that happens as a process. The only difference I see, the major difference I see is that when you use supply chain, there's a bit more emphasis on the cost side, and the people who are on the value chain side are a bit more emphasis on the profit side. And in some cases, they're not exactly the same thing. So I would say that the value chain concept emphasizes the profits a little bit more. And whether you're in the public sector and private sector, it can make a difference because the public sector is less interested in deriving process and more interested in deriving service. So it can make a difference there.
Okay, thank you. For all of our attendees, I'm going to make a last call for questions. I want to remind you that you can type your questions in the Q&A and we'll take a look at those. I do have just a couple more. Brent, for you, one of the things that we've heard a lot about as it relates to food is food insecurity and food access over the last 6 months. And one of the topics that comes up is concerns about food waste. I'm curious, is the topic of food waste at all discussed in supply chains? And if so, how is it relevant?
Yeah, no, certainly. And I think, it becomes very visible when you see news reports of people dumping milk or things happening in terms of animals and food products being wasted. And so certainly we do think about food waste in terms of supply chains. And, there's a lot of work at looking at, post-harvest loss, especially in agriculture, thinking about, especially when you're, after you harvest and getting the, say, pick your commodity, whether it's wheat or corn, and getting that product to a processing facility. Often there's a lot of waste that occurs there in terms of the mechanization that occurs. And so you would end up finding a lot of the grain would be spilled in the field or spilt in the transportation of the product to the processing facility. But really a lot of food waste also occurs at home, and the way that consumers prepare and use or don't use the food that they buy in the store. And so, if any of you are like me, a lot of the time my strawberries or bananas go bad before I can eat them all. And so, we are starting, I think, we have for a while started to think about how we, within a supply chain context, think about either reducing that waste or reusing that waste as well, to take and use that product that we do waste and make energy out of it, or make it into some other industrial type of goods. Certainly, so food waste certainly is a big part of what we think about in terms of food supply chains. If I might just add on to something Vidette talked about in terms of just-in-time delivery. This is something that is really important, especially in the livestock industries. And this is why you saw milk being dumped or livestock not being able to be processed, because those industries in particular use just-in-time delivery methods, where product is produced on farm in a very forecasted or predictable way, or tries to be as predictable as possible. And there is no storage between the farm and when it's processed. And so that processing facility wants to run 24 hours a day, 365 days a year. That's how it's most efficient. And so it needs product to be delivered to that door of the processing facility on a very regular basis. And when that doesn't happen, or when, in this case, the processing facility can't take the product, then this is when you end up with some really big supply chain issues, because there is none of that flexibility that Vidette talked about. There's no storage between farm and the processing plant.
And I think that brings up a great point too about capacity. And in some of these cases, without that buildup of inventory, there's only so much added capacity you can bring in. And so when we think about some of the products that we've seen shortages on, whether it's, toilet paper or other things, there's only, that plant has that limited capacity that it can only ramp up so quickly. And again, it's not just the additional inventory, but it's also how much, how quickly would it be for me to convert a current line to something else, but then also the labor, and not just in, physical supply chains, but also, as what I was mentioning, those service supply chains. So when we think about a hospital setting, how quickly can they bring on new nursing staff? How quickly can, they add more beds to a facility? It's similar capacity issue, whether it's a manufacturing capacity, bed capacity, labor capacity. These are also things that we have tended to, because of some of those cost reasons, not have a lot of slack resources of. And so that gets us back at that, adaptability and responsiveness. Where do we want to have some of those slack resources to be able to respond more quickly?
So Drew, before you wrap it up, I'll just say one thing, if you don't mind. All three of us separately and jointly have written non-technical articles on this very topic. We would be happy to share those for those with those who are interested, so they can simply reach to you and you can put them in touch with us. We'd be happy to share more on our expertise.
To that point, Dr. Verda, we'd be more than happy to post those on our website as well. So if you want to pass those on, we can disseminate those through the IPSR website and IPSR network as well. Thank you.
I appreciate that. A couple of them are popular media articles. I will have to look into the reposting related issues, but we'll certainly look into that. Thank you.
All right, well, we just want to thank all of our panelists. Really appreciate your time today, your expertise, your willingness to share your experience with us and to respond to some questions. So thank you so much. And Arnold, I'll turn it over to you.
Well, I just want to say thank you to you, Drew, for a great session. You put this together. Greatly appreciate the partnership we have with MSU Extension. And my hearty thanks and appreciation to our panelists for taking time from their busy day to be with us and shed some light on this important issue, because I gather as we head into the winter months and through the rest of next year, these issues are going to remain. So great resources. MSU has the #1 supply chain program in the country, proud to say that. And you all show why we have that ranking as well. So thank you for all your work. And thank you to our attendees. Join us in about another 10 minutes. We'll sign off for now. Join us in 10 minutes for a series of 30-minute presentations on COVID implications in K-12 education, unemployment insurance, as well as new innovations in COVID testing and tracing. Thank you so much for being with us today.
Thank you.
Thank you.
Bye.